Assalamualaikum. Welcome back to my channel. This is the part 2 of aortic valve disease. In the first video, we have studied the anatomy of the aorta and doctor assessment of the aorta, how we calculate the Bernoulli equation, the modified Bernoulli equations, and the continuity equations. Now, we study the dopamine echocardiography in the evaluation of aortic stenosis. Contents, introductions, challenges in assessment, dopamine infusion protocol, observation during infusion, critical measures. In the introduction, the relationship between the well area and aortic volumetric flow rate has been well studied in the previous part 1 video. Investigation suggests that increases in flow rate are associated with increases in well area in most patients with aortic stenosis. At a very low flow rate, well opening may be inhibited, perhaps leading to an underestimation of aortic well area. These phenomena create challenges in the quantitative assessments of aortic stenosis in the presence of significant left ventricular dysfunction. Challenges in assessments. In such patients, it may be difficult to distinguish true severe valvular stenosis with low pressure gradient due to low stroke volume, from mild to moderate stenosis with reduced aortic valve opening due to low flow. For example, a patient with cardiomyopathy dopamine echocardiography may be useful to make these distinctions. Dopamine infusion protocols. Using a stepwise infusion of dopamine from 5 to 20 microgram per kilogram per minute may allow differentiation of the two possibilities. The test assumes that the leaflets are relatively flexible, mild to moderate stenosis. The well area will increase in response to an increase in stroke volume. An increase in the well area during infusion greater than 1.0 centimeter square is consistent with mild to moderate stenosis. True severe aortic stenosis is associated with a fixed well area that will not change with dobutamine infusion. Observation during infusions. In such patients, the dobutamine infusion will increase the maximum velocity of both the outflow tract and the jet proportionally. The ratio of peak velocity in the outflow tract and the jet will remain the same. In milder form of stenosis, the increasing the velocity of the outflow tract will be much greater than that of the jet due to the function increase in well area. The ratio of outflow tract to increase velocity will increase compared with baseline. Critical measures. Truly severe aortic stenosis is suggested by a critical measure of aortic well area less than zero point 0.6 centimeter square and an outflow tract jet velocity ratio that does not change during dobutamine infusion. Another possible response to dobutamine is a failure of the left ventricle to augment, in which case neither the gradient nor the well area change significantly. This response is associated with a poor overall prognosis and raises the possibility of concurrent coronary artery disease. So this is the second part of the valvular disease, aortic stenosis. In the previous lecture, we have studied the Bernoulli equations and how we quantify the aortic wall area by continuity equations and the pressure gradient by Bernoulli and modified Bernoulli equations. And this is the Dobutamine study of the aortic valve. So for more videos and lectures, subscribe my channels. Thank you.